Hi, welcome to KJ TV. And as the pandemic of coronavirus continues to ravage the globe, it has really become a concern, and everywhere people are in a lockdown, people are in a curfew, people are in stay home. So all these things are going on. Now, President Trump, despite all this, did something last week, which was funny. When actually the whole world is trying to combat coronavirus spread, send a tweet to states, 3 states which have stay-home order, that is Michigan, Virginia, and Minnesota. And they sent a tweet, Liberate Minnesota, Liberate Michigan, Liberate Virginia, supporting the process group, which, like in Minnesota, which calls itself by the same name, Liberate Minnesota. This demonstration, they wanted to demand the governor to ease back on the stay-home order, which is meant to curb COVID-19. Does President Trump understand? And this equally, in many places I've seen, even different countries, people are still protesting on some of these restrictions about the coronavirus. Now, I want to take an example about Minnesota, where I live and where President Trump had tweeted. This is the statistics in what is happening in Minnesota. You can see the total number which have recovered, those who they got the disease, went to hospital, and they have recovered fully. That is as per April 19, which is very recent, which is just the other day. So the yellow line is the number who are sick. And the bottom line there, you can see those who are hospitalized. So the majority of the people who get sick does not mean necessarily they go to hospital. That is in Minnesota. Those are the number hospitalized, and that is the number of deaths. And then we have the number which is in ICU. And this, you see these figures, they have been controlled the most serious because of these measures to flatten the curve. That is why those numbers are few that, because of the number which is being hospitalized is low, our hospitals still have the capacity to have that. And this is most current real update in the US, how all of these parameters, you can see all beds needed. That's a graph. You can see the one for the beds needed, which is projected. They are needed. ICU beds needed, those curves. And invasive ventilators needed to make sure. So if we leave that goes up, as is projected, if it goes up, then you can see that the people will need to go to hospital. And this is something which experts come up with to control this. And they say that the measures are trying to make sure that the number of beds we have are able to take care of the disease. That's why we talk of flattening the curve, which President Trump has great advisors he should be advising. So if we say Liberate Minnesota and then we go back up spike, surely flattening the curve, as we have said, is that without protective measures, it will be the red sign and it will go beyond the healthcare system. But if we do these measures, we push this forward, and then we have to we control that. Take for example in South Korea. South Korea has flattened the curve. You see that the curve is already flattened, that it is now going negative, slow, because the number of infections are very slow that they can control. Why? South Korea did a number of things that made this to happen. You know, they had already had a system in place. Of course, they had somewhere to start because they had this pandemic of March 2018. they had the experience. So immediately they realized that there were infections from coronavirus. They enacted a law for local manufacturer to make tests based on it. World Health Organization specification. So they started making testing kits. They know that. Testing. Very important. Then they scaled up testing resources and testing majority of people who came into contact immediately. They had even a drive-through testing. Surveillance of cases early enough. So they did that, and then they were able to get people tested. They controlled traveling to their country. So they basically did this, and it was very serious. Actually, they say there was one church organization which was not following this, and that's where most of the cases come from. Otherwise, they controlled it. So without this, we need also to learn this example, because yes, we can say we are liberating Minnesota, we are liberating Michigan. What is going to happen? Let us learn from what happened during the 1918 Spanish flu, which killed so many people. And if we cannot learn from this lesson and why it killed so many people, and actually, this one spread across Europe, Asia, North America, everywhere. So there was actually 3 waves for this. So there was the first wave you can see there, which occurred in July 1918. It looked like it just went down, and then it picked up in October. The second wave, which high death rate, occurred, and then it went down when people went back to measures, and then there was a third wave. That's what we want to learn from, that we don't want to get the occurrence of this thing again. So when we are being told that we need to take care, yes, we need to be proactive so that we can save. So what President Trump is saying does not make sense. It is good to have these measures so that we can control, so that the virus will not get anybody to infect, and then it will die. So that is one thing we have to know. Thank you very much.